need support. We need a change in policy. So advocacy is necessary with government so that we can improve the healthcare of older persons within communities by taking care of looking after these individuals who have dementia. Drugs that they may need will also may be expensive. So the insurance scheme, health insurance facilities may be available with highly subsidized drugs that will make things better for patients who have dementia and those who are caring for them. Individuals who care for patients with dementia carry a lot of burden on their shoulders and they are very stressed. And they also break down because of anxiety, because of stress. They fear that the person may do some harm or do some things that may not be proper. We need to fortify them mentally to be able to cope with this. So we need the psychologists to be able to talk to them about the disease. And we need to also ensure that we talk to them, they know about the disease and know about the various problems that may arise. Now, what we did when we brought the caregivers together on our monthly clinic at that time was for them to share experiences so that they can then suggest ways or forge common grounds for managing problems that arise. And we found that this was very helpful. So it was a way of psychologically strengthening them and improving their coping skills and then making it look like a community effort. Of course, again, this has been eroded because of economic pursuits. Most families in big cities will go for jobs. And so the elderly person may be left at home. And then we then need to employ individuals to provide care. But ultimately, the person who has a memory problem, who has a dementia, needs some care. And this is provided either by family members or by individuals who are paid to do so. We are not there yet, but we hope with technologies available in Western world, some of these will get down to Sub-Saharan Africa, we can use this. Now, I mentioned the fact that individuals with dementia can wander around, leave their house, go onto the streets, and then get subject to danger. If you have technology for tracking the movement of individuals with dementia, it sounds like a restraint, but no, it's just a gadget that is worn freely on the body. Then you'll be able to know how they move around. If you have alarms on the doors, then as soon as they're going out, somebody gets to know and they're able to stop them from doing so. If you have things that will prompt patients with dementia, time to take your medication, it's time to go to the bathroom, time to eat, that will also reduce burden on carers because then they don't have to do more than ordinary ensuring that the person is safe from danger, rather than be the ones to now keep running around. And if the person is wet, there'll be a way of informing them that please time to change the diapers and all that. So technology is helpful. And then with mobile health, you don't have to be with the patient all the time, especially with the era of COVID. So you can have information on what is happening to the individual, even though you are separated by a short distance. But in the last 10, 20 years, with revision of curricula in most of the medical schools, dementia has now featured very prominently. And we now know that diseases of the elderly are receiving adequate attention. So a change in curriculum to include topics like dementia, caregiving, other aspects of mental health of the elderly, frailty, will ensure that medical students are well trained in recognizing early features of dementia and making diagnosis. The first problem is that many people do not like neurology. And when it's geriatric neurology, it's even more difficult. So what we're doing at the moment is to ensure that we arouse interest and curiosity of the younger ones by giving lectures on dementia, showing how some of them are improved and the ways in which imaging has helped us in making diagnosis and solving the problems of individuals that were otherwise thought not to have a disease in the brain. So that has helped us, and that's what we keep doing.